I'm Andrew Whitley with True Wellness Marketing. We provide digital marketing solutions for functional medicine practices. And today I asked Josh Christner to come on with us to do a little training on HIPAA compliance. And the reason why I wanted to have Josh come on is because this isn't an area that I'm too familiar with. I only see the digital marketing side of things, and there are a lot of things that we do in marketing to make sure that things are compliant, secure with their websites, with any of the marketing channels that we do. But I often see when I'm talking with medical professionals, I see little simple things that I know are not HIPAA compliant. For example, we get into like emails and the type of access that they give people to their systems. And that's why I wanted to have you on, because I know that you are a HIPAA compliant expert with Future Solutions. And you've brought in some information here that you're going to share that's going to help people understand, are they really HIPAA compliant? And if not, what are some basic steps that they can do to get the ball rolling to make sure that they don't get these huge fines? And you're going to go over that, as well as how to get in touch with you if somebody wants to do a consultation. And I know you do free consultations for medical practices, which is awesome. Even if they don't end up hiring you, they still have a lot of good information, but hopefully they will just hire an IT company like you, because that's just the point of least resistance. Or the path of least resistance for this. So go ahead and get started and talk about, a little about your background and how you got into this, and then we can get into what you have prepared.
All right. So again, my name is Josh Christner. I am the Director of Operations here at Future Solutions. Also the co-founder of Cloud Hook Communications. We do voice communications as well. Super thankful for you, Andrew, inviting me to co-host with you today. So thank you. Today I brought in just a little information, kind of a mile high level of HIPAA compliance and how you can protect your practice from violations. HIPAA, a lot of people hear HIPAA, they're like, oh, HIPAA, everything's HIPAA. No. HIPAA is very specific. It's known as HIPAA, or the Health Insurance Portability and Accountability Act. It's a critical regulation that sets the standard for protecting sensitive patient information. Why is HIPAA compliance critical? It ensures the protection and confidentiality of patients' health information, safeguarding their privacy and trust. Adherence to HIPAA regulations help prevent data breaches and unauthorized access to sensitive information, which can lead to severe legal and financial consequences for healthcare providers. Not to dig too deep into that, I've got on the screen there, but this is a big thing. All sorts of medical practices have all sorts of data about all sorts of patients. And it doesn't matter how small or big your practice is, you are still responsible for protecting that information. There's three common areas that we deal with as an IT firm in HIPAA compliance. There's a physical, a technical, and administrative. And just to go over the bullet points real quick, facility access control is something that we help with a lot of times, making sure that the physical access to these areas is controlled. Workstation security, starts at password protection, making sure the screen goes to sleep at a certain time. And then disposal of media and information. So if you have a laptop per se that went bad, or maybe a smartphone that was being used by a doctor that's full of information, want to make sure it's disposed of properly. Those are the physical side. The technical side would be technical access control. So that would mean your EMR, maybe your x-ray machine you have on property, maybe there's a PACS that you have access to. Encrypting that data, both during transport, during idle, during rest, and in storage remotely if we have a third party hosting that data for us. Audit controls, making sure that we have a way to track where the data went, how it moved, where it came from. Did it come from Ann's computer or Tom's computer? Being able to have a record to show that information in the case of a breach. And then administrative safeguards, security management process. So, everyone, you hear risk management, risk analysis. There's a bunch of companies that do this. You can third party, or you can do it yourself. The big thing is just making sure that you have a process in place. Workforce training and management. We have third-party companies we work with that we can implement into your environment that will provide a consistent training. You can do it quarterly, you can do it biannually, annually, however you feel is appropriate for your environment, but it gives you a way to track the scores of individual employees and characters in your facility to make sure that they are abiding by the rules as they are supposed to. If they're not, you're going to get that report and you'll be able to train and coach those employees to better handle the data. And then incident response is a huge thing for us. It's not a matter if, it's when. That's how we build the plans out. And that starts as small as what I have on premise to what's in the cloud, what workstations are affected, and how we get you back up and operating as quick as possible with as little damage as possible to the data if it were to be compromised.
So I'd like to get into each of these a little bit deeper and one at a time. So physical safeguards. So I notice when I go into a medical office, they usually have this, you can't just go back to the doctor's office. There's usually a desk where you go into, and there's like this little window where you talk to the receptionist or whoever, you get checked in, and then they actually come and they give you access to the facility. How important is having that physical barrier?
It's huge. A lot of times you walk into a doctor's office, you'll see a nurse's station. There will be documents open on the nurse's station. That's a big no-no. As long as they're escorted, things are covered. Any patient access area should not have things be able to be seen. If I'm walking through my dentist office and here's your dental records just laying out in the open, that's a big no-no. So that door being locked is the first safeguard. If I've got a nurse escorting a patient from the lobby or the waiting room over to the exam room, we want to make sure that, number one, they're being escorted. They're not just wandering about the facility free. Number two, we want to make sure they don't have access or they can't gain access to any sensitive data.
So let's say a medical office doesn't have a physical barrier. Really, they just have a desk. And what do they need to do to make sure that data is not easily accessible?
Well, one thing for sure is, it's old school, but having locking filing cabinets, making sure things are covered. Everything should be under lock and key when it comes to patient data. You'll see a lot of doctor's offices still are on paper chart. The charts sit in a room with a door or maybe behind the front desk where there's a receptionist or somebody there all the time monitoring who's accessing that area. Those safeguards have to be in place. So if you've got a small practice and you're one room with a desk, it's absolutely crucial that you're some way enforcing rules for people who are coming in the door, not allowing just free flow of traffic and full free access to your data.
And then, so you also mentioned about getting rid of old hardware. That's not something that I usually think about, or that people usually think about. They think there's an old computer. Often it gets taken into the back and it just kind of sits in the back office somewhere. And then they eventually probably just throw it out. What is the right process to handle something like that?
So the correct method would be full destruction of the data storage on those devices. So on a laptop, we very commonly will collect all of the hard drives out of old laptops or old computers, and we either send them off to a third party to be crushed with a certificate of destruction, or we will do that here and certify them to be destroyed ourselves using a hydraulic press. But that data has to be destroyed, cannot be recoverable for it to be a HIPAA compliant disposal.
So it's not a simple run a Windows wiping tool.
No, the old magnet, I'll take the magnet, run it over the hard drive. That doesn't necessarily remove the data. There's situations where we have to do data harvesting on maybe a failed hard drive or something like that. I can pull back 10 to 12 copies of that disk and layers. So I can go back, you deleted a file 6 months ago. It may still be in the hard drive if I run the data mining on it.
Yeah, so you actually did that for me before. You recovered an old hard drive that I had, and I knew you did this, so I sent it to you, and you're like, hey, let me, and it's all this garbled data, but it's all there.
It's there. And
information.
That's the thing a lot of people don't realize. A lot of these, I'm going to call it identity theft situations, they start in a trash can. It's somewhere you applied for a job or somewhere you applied for a credit card. I had my credit card compromised at a racetrack gas station. Guess what? I swiped the card. There was no skimmer on there. They got it through their actual back end, the transport between the gas pump and the credit card processor. So it can leak anywhere.
So you also talk often about how to make sure that your workstation, your computer, your monitor, that it's also secure. Yep. What are, because I know that people leave like sticky notes and other kind of stuff, passwords, because sometimes these places, they require these like really long passwords. like 15, 20 characters and you don't remember it. So they'll have it on their phone or they'll have it on a sticky note somewhere. What is the best way for someone to know what their login is? Because sometimes you got to log into multiple softwares, multiple places.
So we recommend a password manager at the very least if you're somebody who can't keep your passwords, and that's usually done through a secure application on a secured workstation. But you're going to have certain passwords. A lot of the EMRs require 2 to 3 passwords to get to the data. We've gone to
Because one to log in, one is then
right.
you're then the staff log in, and then to get to a specific thing where you order things like prescriptions, and this might be a separate login because it's really multiple softwares in one. Some of these.
Well, and so a lot of this has even changed even further now. So the password's not the important part. They use multi-factor authentication. So your phone will have an application on it where when you go to log in, it'll ping your phone. You press the application and it'll have on the screen, oh, press 42, do this, do that on your phone, and it will unlock the computer. That's part of Zero Trust, which is something you'll hear more about as time goes on. It's kind of the new standard for security. Because passwords are crackable. The amount of computing power we have now, you could have a 30, 40, 50 character password. The hackers can still crack it. In the back end, a lot of these servers are built in a way where, hey, after so many attempts, we're going to block you. And that helps to a point. But I can also get the data in other ways. So that's why this multi-factor authentication, you'll notice Amazon has forced it now. Google's forcing it. A lot of these other companies are forcing it because it's stopping the hackers. I mean, it's really slowing them down at least.
Right. So also, let's say an office member is using one of the computers and it's their lunch break, and then they might want to check their personal stuff, or they might want to go to check some other websites or play some games or whatever. How do you make sure that those office devices are secure and only using legitimate work?
So one thing,
program?
obviously, it starts with your employee training and them understanding that this is unacceptable behavior. We don't allow this, and here's why. Number 2, we have endpoint protection and management tools we can deploy in your environment to restrict certain content, restrict access to things, make sure the computers can't have random things installed. I mean, we get down granularly to the USB ports, making sure those USB ports are turned off. They go to plug their phone in to charge their phone. They can introduce a virus into a computer through the phone. So these are all
like only while charging allowed or something like that.
Right. So well, it won't even let you do that. It kills the USB port completely.
I'm talking about you just doesn't plug in your phone into the wall. Then instead,
you plug it in. You plug it into the wall. That it doesn't touch the computer.
Got it.
And then the other part of it is, we go back to that endpoint protection. That's where it all starts. Because you're going to have something happen at some point. You can implement all the policy procedure. You can put in Active Directory and do all these things to lock down your environment. Somebody's going to do something. And so that's where we come in. We implement an endpoint protection that if there was a ransom or there was a hack, it kills access to that computer. It isolates that computer, not only from the network, but from the world. So it doesn't continue whatever's happening. That leak stops and it flags immediately and lets us know. And if, let's say you have your office has an on-premise IT person, they'll get notified as well.
Okay. So those technical safeguards, it's just, I mean, it's sometimes you think that it's a really complex thing, but sometimes it's as simple as what you have access to.
Yeah, it's that's the other thing too, is access control, period. Who needs, I don't need my receptionist having access to x-rays, unless she's doing some sort of file transfers for, sending files off, which there should be a process for that. How are we getting an authorization for that? How are we sending that data? There's so many pieces to the puzzle.
So this also gets into the way your business is set up. I know we talk a lot about email. What is it about? And I've seen it before. I'm emailing doctor's offices, and it's like Dr. So-and-so at gmail.com or at yahoo.com. And now I remember when I started my business, literally the first thing I did when I bought my domain was get a secure email. Now I got mine through Google Workspace. But why is Gmail different than Google Workspace, Office 365, or other
So,
secure email providers?
number one, in HIPAA compliance, there's a golden rule. If you don't pay for it, it's probably not HIPAA compliant. Uh, Free Gmail does not have the proper encryption and protections that are required by HIPAA. So when you talk about email, anytime you see that Dr. So-and-so at gmail.com, that is a prime example of somebody who just doesn't understand. You're putting yourself at risk. Those email accounts are not designed with the proper protections. G Suite has the vault. There's all sorts of things that G Suite can do, filtering, spam controls. You have none of that protection when you're operating in a free account. That's number one.
So what is the difference though? Because like when I log into my personal Gmail account and I log into my Google Workspace Office, business account, it looks the same.
Yeah. No, and they function the same in most ways, but it's the back end. Okay.
Okay.
So I for a moment, I'm trying to simplify this. So imagine your house. You can buy the $3 filter at Walmart for your air conditioning system. Okay. Or maybe it came with a box of them for free, just a cheap little green mesh filters. Or you can buy better paper grade filter, something larger, something better. It's the same way. HIPAA compliance does not like free services because it's free. Number one, it doesn't have any of the advanced safeguards. So in G Suite alone, there's, I want to say probably 5 or 6 different apps that relate to email that help secure your email services. The level of encryption, Gmail's only encrypted. I think they're TLS 2.0. You get into a higher end account with G Suite, you're going to get better encryption at rest during travel. There's also the spam moderator that comes with the paid subscription to G Suite. And that's going to catch a lot of the garbage emails that come in, and they look.
Oh, so a lot of those things, a lot of those phishing scams and a lot of those other
social engineering, all that stuff. It's going to catch that. Also, when you're transacting patient data, you have to make sure, number one, that the patient has authorized you to communicate with them via this. So in the G Suite, there's some of those features as well. There's other methods. A lot of the new EMRs have a third party, basically file share built in now. So you can go into the patient's information, you type in their email address, hit send. It's going to send over their full patient data or whatever pieces you want to send them, but it makes them log in using personally identifiable information. So whether it's the last 4 of their social, their birth date, their current address, maybe the last date of their visit, whatever it was, it's going to use that information to verify this person. So, and the same thing can be done from the doctor side. Hey, look, I've got a call in from so-and-so patient who wants their data because they're going to a different practice. Okay. Well, the first thing we do is we hang up that phone call and we call them back on the number we have on file, verifying it is that patient, because that's the first thing. And then make sure we verified them through whatever form it is. Hey, what's your insurance card number, birth date, whatever, social security number, however you're tracking your patient information.
Right. And I guess that's why also if let's say I call in, I want to make an appointment for my wife or something to any medical office, I have to be already on there. And that's why, usually when we go in to register at a new doctor's office, for example, they have some forms to fill out and they say who else is allowed access. And it's a HIPAA release, but it's a HIPAA form, basically. Who else is allowed access to your account, to your patient information, and to make appointments, blah, blah, blah. And of course, we always put each other on as spouses when we do this. And of course, our daughter, because we make sure both parents are able to get access to all that information. So that when I call a doctor's office and I say, I want to make an appointment for my wife, and they say, what's your name? And then they just verify who I am. And then I can actually make an appointment and everything else. But so that's important. So how does let's say a small practice who don't have, I guess, what is the best way for a small practice to make sure that these things are in place?
Well, the first thing, if you're unsure, seeking out help from someone like myself, my company. There's other companies that do this. There's actually software companies that have built checklists to help you work through different pieces of the puzzle. HIPAA compliance involves so many parts of the business. It's hard to find one person to handle it all. But it starts with just trying. A lot of people think that improving your HIPAA compliance requires some sort of massive overhaul, and oh, we've got to redo everything. So HIPAA is a best efforts policy.
Right.
And just starting somewhere small, it doesn't require thousands and thousands of dollars to start. You start with
Yeah,
simple,
I know you have a
actionable.
list. We could probably
Yeah,
get into your list that you have of
yeah, we can
some
hit the list
quick
next. That's
quick
fine.
tips. So,
So you
yeah.
brought up sticky notes.
Hmm.
This is a pain point for me. I can't tell you how many doctors' offices I go into, even imaging centers. They've got the password sticky noted either to the monitor, on the back of the keyboard,
On the desk somewhere. Yeah.
underneath the mouse. It's unbelievable. And while there's obviously an effort to secure the password, this does not meet the requirements for HIPAA compliance. And every time you write a password on a sticky note, each time you have a password or information, that is a HIPAA violation.
So
HIPAA
I guess
violation.
would a good rule of thumb be, let's say someone breaks into your office in the middle of the night. Is it basically okay? Would they be able to get into your system? By looking around your office, by doing a
That's
quick.
one way to look at it.
Mhm.
The other rule of thumb is just don't write passwords down. If you have a
Yeah.
binder with passwords in it, which I don't approve of at all, but if you do, it needs to be in a locked filing cabinet. It needs to be locked up somewhere. It cannot be open air, is what I'm
What about
getting.
a secure file on your computer?
There's two ways. I don't like seeing, so I've got clients who want to play that game, and
Because
you
I've
can have
seen
it
that
encrypted.
where I've been with a client and
Yeah.
I'm like, hey, what do you have your password for this? Do you have your password for this? And he'll just pull up in a Word doc or something,
And it
and
can
it'll
be
have, here's all
encrypted.
my
It
passwords.
can have a password. That's all fine, but that is not proper. You should be
Okay.
using either a proper password manager, because even encrypted on your desktop, where's your encryption key? What are you using to store all that? There's things that
Hmm.
matter in that conversation. So I tell people,
So
don't do it.
what is a simple, like, let's say just a few dollar a month kind of password protection program that somebody
So
can
there's a
use?
couple of different ones. LastPass is a common one that a lot of
Okay.
people
Isn't
use.
that Google?
Um, no, that is
Or Google
not.
has a password manager too, don't they?
They do, yes, but it'd be the paid version that would be HIPAA compliant. I
Got it.
still don't. Keeper Security has a password manager. It's not a requirement. I want to be very clear about that. It's not a
Mhm.
requirement by any means to have a password manager, but it is the right way to do it if you're looking for a long-term, safe, manageable way to keep your passwords. One other thing I didn't mention, and I forgot to bring this up, password sharing is a HIPAA violation.
Got it.
You are supposed to have your own password for your own
So
user,
so
all those
each you
purposes.
each employee who is logging into your system needs their own. Is that to the computers and any of the software?
That's computers, that's software, it's everything. The software more so. I mean, the computer we can
Hmm.
try and get away with it, but I would tell you 9 out of 10 times, I'm never going to set up a client like that. They're going to have individual users for the and so a lot of people are like, oh well, I don't have Active Directory. I don't want to pay for that because it is expensive. I'm not going to lie to you.
Hmm.
You're looking at either an online like Azure AD, or you're looking at a server on premise to do this. But there's the cost of the security versus the cost of a violation is huge. Number one. Number two, it helps with maintaining those users only having access to what they're supposed to have access to. If you've got a shared computer and you've got people logging in and out of that computer every day from the same user account, well, what if one day I forget to sign out and I'm in the administrative console on this computer, and now this, let's say it's the receptionist now has access to the full back end of the server. That's a huge issue.
And that goes into your fourth point here about making sure that all of your computers are automatically logging out. And it's not just a
Correct.
screensaver where you can just click a button and then it opens everything up. It's having a log out. And then, so ideally, I guess everyone would have their own login too. So like Jane, whatever, would have her own login, and then it'll be all logged into the system. So you know that, okay, Jane had access to this computer from this time until this time.
Yep. It's all logged, so we can go back and look. Hey, Jane was in
Hmm.
the system from X to Y to Z. She accessed X patients. One thing that happens, and a lot of people don't talk about it, Let's say there was an issue with um, a patient that one of the employees knew the patient and they were having a problem with them. This patient information could be used in retaliation.
Okay.
So we can track down what happened. We can track down where they got that information from.
Got it. So you put it here 15 minutes or less. I mean, what is ideal for? I mean, because obviously, you can just get up, go to the bathroom real quick, you come back. Important.
The rule is 15 minutes, generally speaking. I would tell you in all of my setups, I usually run 5 minutes at the most.
Okay. So if you go grab something from the kitchen or if you go to the bathroom,
Yeah.
you're probably fine. Otherwise, if you're leaving to take your lunch break, then it's going to log you out whether you log out or not.
Right. So one of the other things is um, the bigger picture there. Okay, is the computer in a private office?
Mhm.
Is that office secured by a door? The 15-minute rule is fine if it's secured. If not, then we have a bigger issue.
So this is out in the open, and then the doctor can go back to, or whoever can go back to lead a patient back to a room or whatever. Someone can just jump on that computer.
Right.
Then you need a shorter window,
Yeah.
just a couple minutes that somebody can.
I honestly, some of them, they require a badge that actually hooks on into the computer, and as long as that badge is in the computer, you're logged in. The minute you pull the badge out, it logs you out. And that's my preferred method is something.
Oh, got it. So there's actually something, it's a physical thing there.
Mm-hmm. Yep.
And how does that work?
So basically, it is a Microsoft and other OSs offer a similar security package too, but Microsoft is obviously the name of the game. So you take your badge, you come up to the machine, you can either do a tap. A lot of them are NFC now. Boop. It's going to let me log in, do what I need to do. After so long, let's say it's 30 seconds of idle or 45 seconds of idle. It's going to say, hey, scan your badge, or we're going to end the session. And then if you don't scan your badge, you're going to end the session.
Got it.
So it requires that separate tokenization of your badge to continue the session.
So it's kind of like two-factor authentication when you log into something, how you get a text to your phone or a verification to some other email or whatever it is, just to make sure that it's just an extra wall to get through, but it's minor. It's not like it's going to take time out of your day. It's just getting used to, okay, this is how I log into this.
That's the whole thing. So all of this HIPAA compliance we're talking about, it all is little adjustments to how you do things. So a lot of times I come to a facility and they're like, oh, that's going to take so much time. Well, but if you build it into your process, you will expedite that time. And I always present the cost. Every time you talk about a HIPAA violation, you're looking at $50,000 per violation. And all it takes is one. You have an exposure of over 500 patients' data. It's a mandatory self-report. And now the eyes are on you. And they're going to.
How do you know though? How do you know if your data's out there? How do you know if you have an exposure?
It's real simple. If the access was available at that time. So, we'll have a situation. Let's give you, for instance, I got involved with a particular client years ago through this wormhole. They had a breach. The breach was 52,000 patients, I believe. So they're looking around trying to find somebody to help them manage this because now the regulators are all over them. They never had anybody to help them be the middleman and help.
They didn't have an IT company.
They had nothing. They had a doctor who was their IT director, and he did not know what he was doing. So they were lucky. They only got pinned for 2 violations. It's $100,000.
That's still a pretty big deal. Even
long and short, though, that's a salary for an annual somebody on premise to manage just your HIPAA compliance or less. I mean, it's crazy not to have something in place. So now,
how many violations could they have been dinged for?
They had 37 verified violations.
So they could have been dinged for almost $1 million.
Correct.
Oh no, how many is that? That's over $1 million.
Yeah. So the big picture was they learned their lesson. They made the changes. We've been managing them now for 3 years. We've not had any issues since. But that's because I've implemented all the changes that were necessary. And the doctors still fight me on it. Oh, we don't need to do that. We don't need to do that. But I can
So
show you
even
why.
then they still
Yeah.
are not fully
And they,
on board with everything.
one of the big gripes is, well, I pay my nurses hourly and this extra work costs money. Right. But that extra work that costs money is still cheaper than the
Right.
alternative, which is millions of dollars in fines, reputation loss. You have to notify every one of those patients, hey, we had exposure and your
So
information.
you could lose patients
You could
off
lose
maybe
patients.
either way.
You
Yeah.
could be sued by the patients for it.
Oh,
There's
so if
all
someone has
sorts
their
of
identity compromised and then all of a sudden they have issues that happen and then they find out that it's you who
you're
leaked their
liable.
data, so they
You're
could sue
liable.
you. Now, where does a cyber policy come into play?
So in a medical
All right, I guess
practice,
first we should make sure we define what that is, but
yeah, so
because
cyber insurance policy is basically it covers you, the practice, from any loss or damage due to a breach or issue within your infrastructure.
does
So
that include the fines?
yeah, they will pay some of the fines if there's fines. Yeah, it just depends on
Okay.
what your policy, how your policy is written. There's a couple of standardizations on how that's done. A lot of insurance agencies do not like, or companies rather, do not like high risk clients, i.e., payroll companies. They've got a bunch of data that they're handling, doctors'
Mhm.
offices, financial institutions. They do not like working with those people. And one way you can get a policy without having to bend over backwards is to make sure you have everything in order. So when they ask you, hey, how many audits have you had? How many vulnerability scans are you doing a year? What's this? What's that? That's all stuff that a company like mine would make sure you have.
Would they
Um,
require a third party audit, or is that self reported? Like, oh, we
no,
we
it's
we
it's a
fit all these things.
so a lot of times they're going to send you a form. It's usually 10, 12, 15, 30 pages, depending on the type of business you're in. That is
Hmm.
going to ask you all sorts of questions about from the way the internet comes in to where the data goes, how it's stored, encryption levels, multi-factor authentication, two-factor authentications, everything. It's just everything about your infrastructure,
Hmm.
and the type of data you host. So once it gathers all that information, they're able to give you a quote based on the risk, obviously. Um,
Oh,
so
so if you're checking all the boxes the right way, and especially if you have, let's say, an IT company who's already verifying,
yep,
hey, we are doing all these things, then your rate for a cyber policy is going to be much lower.
correct. So the big right
Kind
now,
of like a safe driver is going to have a
yeah.
cheaper insurance, unless you're in Florida like us, then it's with
So
no
one of the
fault.
things I always use it as an example. So car insurance companies love to put trackers in your car now. They want to
Hmm.
know how you drive, how hard you're braking, whether you turned your turn signal on when you made that turn, all that stuff. So they give you this little device, you plug it in, and
Right.
they will give you a 30% reduction for running it for 3 months every year, just to make sure that your driving is the same as you say it is. And you safe driver on your driver's license doesn't mean you're a safe driver. It just means you haven't been caught yet. So this
That's
is
why I
very
don't. That's why I don't use those devices because I have
so
a perfect record. I've never caused an accident, but I like to drive a little faster. So
yeah, there you go. And but that's where these insurance
yeah.
companies are kind of doing the same thing now. They're requiring
Mm.
certain things, they're requiring data. They want to see metrics. They want to know where you stand. So it's not all companies that are like this, but there are some. When you're dealing, most companies would take on the liability of a medical practice or a payroll company or someone like that. They're going to want those details for sure. They're going to
Mhm.
want to
So do you
know
so do you recommend your clients get a cyber policy?
absolutely 100%.
Hmm.
The
And
reason
how much does it
why
usually cost for something like that? Because I know it can potentially save you millions of dollars for
but it's
something.
thousands of dollars a year. I
Okay.
can tell you the largest one I've heard was like $280,000 a year for a policy. The
Hmm.
smallest one I've heard is like, 3 or 4 thousand a year.
Okay.
Um, the larger policy that's going to be for like a PEO, a large
Right. Right. But for a
entity.
small medical office, I mean, I guess you really don't know until you do the
There's
risk
no way to
assessment and
even
everything. There's
these
no way
are
to
these
know.
numbers, and to be very clear, I'm spitballing numbers. I have no verifiable
Sure. You're
metric
not an
to tell
insurance
you.
agent. You've seen the policies and that's
I've just because I fill out the paperwork and I usually work with the client on them to make sure that number one, we're meeting all the expectations of the insurance agency. Some of them
Mhm.
have other requirements that, oh, our metrics on people who have this certain brand of multi-factor authentication are better off. Okay, well, we can move you to that if that's what they want. We verified it's a good product. Boom, boom, boom. and I make sure my clients get the best bang for their buck. That's my goal.
Okay.
So
Give them the best protection for the best price based off of
right.
what protection they already have. So you also know what they likely need in their policy to protect them. Because even though
Yeah.
you put all these different firewalls and safety measures in place, all it takes is one employee or one person just to grab some data and do something with it. Just
Yep.
like I've been to restaurants where my card was charged for a bunch of extra stuff after going to a restaurant because the waiter just probably took my card information because they
Yeah.
have my card and
They
other
can
things
do
like
that.
that.
There's all sorts of issues. That's PCI compliance. That also relates to what we're talking about today too, but that's
Yeah.
another conversation.
So you mentioned in your next bullet point, and you mentioned a couple of times about training your team on HIPAA compliance. How does that? Because I know that most medical offices they already have an onboarding for their training. They do have some trainings involved. How do they make sure that training includes the right HIPAA compliance standards? And how do they make sure that their team members are always up to date? Because I assume this also changes on occasion.
It does. So we work with a couple of different vendors specifically for HIPAA compliance. So a lot of people have this like they've heard this thing, oh, HIPAA certified. There's no such thing as a HIPAA certification. Be very clear about that, number one. Number
Mhm.
two, the training should be done on a regular basis. This training should be up to date, current with the current rules that are in place regarding HIPAA compliance.
Because every year there's
So,
more technology that comes out. There are more scams
correct.
out there that happen. So I assume
I mean,
that how much do they update things yearly?
it's pretty substantial. Every year there's changes. Now they've got a very
Mhm.
specific, like you can go and get the list of the changes they made. But the problem isn't so much that. So obviously we want to keep current information. But I
Mhm.
also want to know, hey, is Mr. Employee number two actually following the rules? Is he listening to the trainings? A lot of times, oh, we do continuing education. Well, continuing education would mean I watched a webinar like this or something along those lines and maybe took a little test. But what about regularly? I'm testing and I'm changing the verbiage in the questions to make sure that the test that the employees are answering, they're not just guessing. And if there's areas that need to be coached, we can coach that employee on why it's important, or maybe even move on from the employee if they refuse to adopt the rules. A lot of times, companies will have policies in place. Yeah, you sign the policy. You're not doing anything other than having leverage to let them go. You're not protecting
Mhm.
yourself from the liabilities. So with these certain vendors we use, we can actually establish they took the training, they knew what they were supposed to be doing. And when you go, let's say, and I'm not saying it stops it from happening, it can still happen.
Mhm.
You have a breach, you can take all that data and take it to the Fed, say, hey, I did the best I could. And that's what we're looking for is that best effort. It also gives you red flags before anything happens. You've already known, hey, this guy's on the list. I got to get rid of him. I got to get this guy trained, or I need to need to move on, or maybe
So
change
are
a position.
these are virtual trainings like this where you do virtual training and then you need
Yep,
to gather some data, maybe do a little studying, and then you take a test afterwards to make
correct.
sure that okay, this is how things need to be secured. This is what this
Yep.
means. This is how you access or manage a certain patient's data. This is what
Mhm.
this is how you take care of this stuff. How long does these trainings last? How much do you have to do?
So generally speaking, it's set based on what you at the administrative level want. I can tell you most of the trainings it's an hour um, per year or an hour per quarter, whatever you want to do. They can do it at their leisure. So it sends them an email, gives them a portal to log into. They take their testing, and that's it. And you get a report on those testing. You may have employees who are refusing to take the testing. That's going to show up in that portal because you can see who's done what, how long they've done it for. If you saw an employee who went in there and answered the question in 5 minutes, it's an hour training, you have some coaching you can do there.
Or they're
Um,
just really good, maybe they already know
well,
the
and that's where you need to evaluate that because the
right.
average person takes an hour. 30 minutes would be reasonable. five
So they
minutes,
could have just Googled it or something and be like, or
correct,
used ChatGPT. What's the answer to this question? And then
correct. We don't want that. We want them to actually answer from memory. We want them to
Mhm.
to learn this stuff. And if they don't know, it's not necessarily we're going to punish you, but we need you to learn. So hey, I need you to study XYZ. In 2 months, we're going to have you retake the test again, or a month, or whatever it is. That can be part of your action plan for your employee.
Right.
Um, I want to move down the list a little bit if that's okay with you.
Sure. Yeah.
So patching updates on computers, this is a common point of failure for most medical practices.
Okay.
They come in the morning, they turn on their computer, they use it. Hey, you have an update pending. I'm busy. Stop. I don't want to do
Right.
that. And this goes on and on and on and on and on and on. And they turn their computer off at night because, hey, we're saving electricity. It's going to save the wear on the computer, what have you. This is something that is a weak point in most practices. They don't have some sort of update management occurring. Part of my managed services package is we manage your updates every Thursday night. We push all the pending updates. Everything critical will go during the week, off peak. But on Thursday night specifically, we do a big push for all your firmware, all of your Windows updates and things like that. A lot of people try to self-manage this, and I've seen this, and it's a problem because you have no way of verifying. If you're telling your employees, hey, make sure you update your computer every day. Well, how are you verifying the updates were done? How are you verifying if the update failed or not? And this is a great point of where I can take my clients and show them the value of my services by just this alone. A simple Windows vulnerability on, it's usually a part of your software you have on your computer. Hey, there was a vulnerability, CVE was put out, Microsoft did a patch, it needs to be put on ASAP because it's a vulnerability. Right. And I've gone in, some people are,
So there are different types of updates, and as an IT company, which ones we need to roll out now, before you even start working, and which ones can be delayed until Thursday or whenever. Because I know that like on my computer, I don't know how it is it's set up where basically it just does the regular Windows updates like automatically. Like I'll turn on my computer, it's like, oh, it's doing an update. I guess I got to wait a few minutes to do this. Why not set things up automatically for something like that?
So the problem is with the automatic updates, if they're not pushed in a scheduled pace, it's going to interrupt business flow. That's number one.
Got it.
So the update.
So sometimes these are longer than just 5 minutes.
Correct. You have updates that can take an hour sometimes. If it's a big update. One of the big ones that's going on right now is Windows 11. So a lot of people are on Windows 10. Their computers are going to upgrade to Windows 11, but they weren't ready for it. And the computers in the middle of this update, they show up at 8 o'clock in the morning.
And so it's updating from Windows 10 to Windows 11, which is a multiple hour process usually.
Correct. So
and then you got to check all the programs and some programs need updates, and you got to do Windows updates after that because you upgrade, and then you got to do 3 batches of.
Here's the real the pinch point for me on that. So their software now currently most of everyone's caught up and they're ready for Windows 11. Most of your software is ready, but back when this first started happening, the software companies hadn't updated their software to support Windows 11.
Was that about 2 years ago or something?
Yeah, a year and a half, 2 years ago is when it really started happening.
So even these EMRs, some of them weren't ready to update, so they wouldn't be working, and then they'd have to roll back to Windows 10.
If you caught it within the 10-day window, you could roll it back. But once you went past that 10 days, you were stuck with Windows 11.
Oh, geez.
So one of the things that I've made a point of with this is I have to wash your old computer out. It's silly not to have management. We can put restrictions on what updates can and can't go, what time frames they can go in. Look, if a critical update comes out at 3 o'clock on a Tuesday, which rarely does it ever happen like that, but if it were to come out, we want to push that update. I can schedule in, hey, there's an hour between 12 and 1 where this client's on lunch. We're going to push that update, make sure it happens. So
you just send a notice to the client and be like, hey, I need you off the computers at noon. Yeah. And then and then they can let you know, hey, we're still got some patients who got to get out the door. Can you delay to like 12:30 or whatever? And then they could work with you to make sure those are done in a timely
Absolutely.
manner. So what about, I guess it probably happened because I remember I bought a new computer a couple years ago and it came pre-installed with Windows 11 and I couldn't go back to Windows 10 because it's literally built on Windows 11 and I had some programs that didn't even work after that.
Okay. Yeah, I mean,
so is that something that you would look into that as an IT company? So you would see what softwares they need, and you would see, okay, what is it? Because I mean, eventually there's going to be Windows 12, there's going to be Windows 13, or whatever.
Right? It's going to keep growing, and that's one of the things. So in the next slide, you'll see I've got some part of our assessments. It's end of life. You got end of life hardware, end of life software, end of life network equipment. There's all sorts of factors and vulnerabilities that can occur. And that's all things that are very important to take into consideration when you're operating a business of any sort, specifically HIPAA compliant. One thing that a lot of people don't think about is that phone you got on your desk, that VoIP phone, works great. Everything's wonderful. Well, that phone is 5 years old. You go to the manufacturer, it's end of life. It hasn't received an update in 3 years. Phone's not HIPAA compliant. It has to be replaced.
Got it. So it's not,
As
so it's
silly
not
as
just
that
your
is.
computer, because and I know that a lot of times we focus on your computer. Like I remember I went to a client's office and they're on Windows 7, and this is actually one where I brought you in because
Yeah.
just talking with you, I knew that hey, if you're on Windows 7, I mean already if you're on Windows 8 or 8.1, it's already I think it even expired or
Oh
going
yeah.
to be
Windows
expired
8's
soon.
been out for a couple of
It's
years
gone
now.
too. But at that point, Windows 7 was the latest, or was already gone, and I noticed that she was on Windows 7. I'm like, hey, just so you know, you're not compliant with your industry, and
Yep.
I need to get you in touch with someone who can help you out. And you were able to get in and get them all updated, and it was a very reasonable amount too. It wasn't like,
Yeah.
it's not like it's not necessarily like tens of thousands of dollars they have to spend to do some
Well,
of these things.
I always explain to people there's a certain level of effort I put in with all my clients to find them cost-effective solutions for their issues or needs. Um, it doesn't require thousands and thousands of dollars. It requires a plan and a custom tailored solution for your needs. You can go and do it on your own, but you'll probably end up spending just as much, if not more, when you do it on your own versus hiring someone like me or my company, because we already know we're in doing this every day. We've
Mhm.
test benched all the equipment I sell. It starts here in my office. We've used it here first. The software, the antivirus. One of the last bullet point on here is
Yeah,
disable the option for
antivirus.
antivirus software. As
Yeah.
silly as that sounds, that's a huge, huge issue I find out in the world. I've got users with administrator credentials on a local machine, and they've got Spotify, they're running a game, their kid came, wanted to play Roblox. Like it's always a mess.
Oh, so what happens is they go and they want to install a program or whatever, update something or whatever, and it says you can't access this because of your firewalls or whatever. So they disable their antivirus.
Can't have people doing that. Um,
Okay.
so that brings us to the next point. So uh, what I do, what my company does. We do managed services, general technology consult, remote and on-site support, regulatory compliance, support and consultation. So you don't have to sign up with management for me to help you with HIPAA compliance. It's something we
Mhm.
can do by the hour, or build you a package based on your needs. The catastrophic incident planning is a common one I do a lot of for. I've got companies where they have an in-house IT person, and I come in, I evaluate, and I help that IT person build out a plan if something were to happen. Workflow and process evaluations, ransomware prevention mitigation, and ISP management. All these items can be related to a medical facility
We
or
didn't talk about ISP much. You want to just jump into that real quick because that's
certainly.
something that I've seen before as well, where it's
Yeah,
open
so
networks and stuff at offices.
a lot of ISP stands for Internet Service Provider.
Mhm.
And the problem is today we rely so heavily on that internet connectivity for your EMR, your credit card processing. You want to view images. Someone went to a radiologist and had some, images taken. You want to view them. Well, now you do it all through the internet. It's not that it used to be a CD. You take it to your doctor. Here's my CD.
Yeah.
Um,
I got
so
one of those recently. I had to go to I got some x-rays done, and this was like a year and a half ago, and they had it on a CD. I'm like, what decade are you guys
there's
in?
still
Like,
some people fighting the old school. I'm trying to get people to go to thumb drives. That's
at
my
least that.
hand
And it's
people
so
a thumb
cheap.
drive.
It's like 50 cents for you're gonna get bulk thumb drives. They're so cheap.
It's trying to leave that old thinking, right?
I'm like, they
So
literally gave me a CD in a case. I'm like, I haven't even seen a CD. So,
so a lot of these ISPs will try and sell you things you don't need, or
hmm
try and give you something that doesn't fit. Oh, our firewalls are secure. Oh, our
hmm
Wi-Fi is secure. Well, it's not put in correctly to begin with. It doesn't have the ability to have network segregation. And I'm talking about true separation of networks, not just, oh, I've got a Wi-Fi that's a guest network. Well, a guest network just has a different password on it. It can still have access to that internal network. You don't want that.
Got it.
So we help from start to finish with your ISP. You have an outage, we're on the phone with your ISP. We're the ones dealing with it. We're making sure you have a redundancy. One example, I actually was able to get a client back up and running utilizing my Starlink. They fought me for years on getting a backup internet, and they were down and out, and down for 2 days before they finally called me crying and begging me for something. So I took them my Starlink unit, set it up in the back of their office, plugged it into their network. They were back up and running.
Because that literally, like, they can't. I mean, 'cause that's how you access records now. I mean, you can't just.
they
You need
were
the internet. It's not like
they
the old paper chart days
yeah,
where you just have you just go. Let's go to the file cabinet, pull out their file.
correct.
So
So
okay.
that's where that comes in. And ISP is it's such a sticky thing. Some are contract based, some are not. You've got fiber, you've got cable companies, you've got satellite, you got Starlink, you got cellular now that people are trying to push down. We have real world experience, and with that real world experience comes contacts with the ISPs, and we're able to provide a support that will ensure continuity of your business as time goes on.
So talk about segregating those networks. So because you mentioned that if you just create on the same router, you create a guest network. How is that not? So that is not secure. You actually need a separate router. I mean, how do you set that up to be correct?
We can do what's called logical segregation. And that's where we use usually VLAN technology, virtual LAN, and with a combination of hardware, switches, access points, we're able to separate the traffic based on the correct network it's tagged for, or untagged. It's just an untagged network on that port. So the long and short of that is, if I've got a Wi-Fi solution in an office somewhere, and I've just simply got a Comcast router plugged in, and I've got an access point, and the access point, some of them, Unify, Meraki, they will offer a no interconnect on the network. The problem is the traffic's still running through the network, whether or not they're not allowed to communicate into the network. It's still running through the network, and contamination can still occur.
Oh, so it's still, because it's still on your network, they can still access things. They can still open up even a ransom file or something.
If they know what they're doing, yes, they can get in. And that's why we recommend a proper segregation, utilizing a separate subnet, a proper set of firewall rules that denies access either between or with anything inside that we don't want them to touch. And when it pushes them out, it pushes them through a content filter to ensure that we're keeping everything at bay out at the front. They go out and they're trying to do something. Hey, I want to watch, these videos that are inappropriate, this, that, or whatever. We can stop that from happening on the guest network. Some of my larger, and this isn't necessarily HIPAA, but there's federal regulations around certain different facilities that are funded differently, whether they receive federal subsidy, state subsidy, whatever. They're required, based on that subsidy, to not allow certain things on their networks. TikTok in schools is a big one. So TikTok has to be completely X'd from the network. And I don't care if you're a guest or you're a student or whoever, you still have to have no TikTok. And that's one of those things that when we're building out the network, we engineer the network properly to ensure that we're protected on all ends, even if they're in the guest network.
Okay, so how do you so you can't just call, like, let's say you have Comcast or Verizon for your internet. You can't just call them and get the stuff set up?
No, the garden variety version of Comcast or Frontier is not going to do that.
So even even if you have a business account, like, because my family's business, we had a business Comcast account.
It's literally just they charge you more because you're business. You're on the same network. It's all the same. There is some like backhauls and stuff that are business, and that's different. But they have business services, so they have like what I'm offering, managed services. Frontier offers managed services. Spectrum, Charter, they offer managed services through their own third party. So you can contact them and receive those services. The issue therein lies, they're normally not very cost effective. And they usually have a box they want to put you in. You fit in this box right here. So, is it doable? Absolutely. They will offer you that support at a cost. But if you're looking for something more cost effective, someone who's more interested in you as a client, not just as a number, you're going to want to seek out a smaller operation like myself, or there's many other MSPs out there doing the right thing by people.
Okay. So what else do you have for us?
So I want to just offer everyone, I do a free 1-hour consultation, and goes over a couple points. It's discuss your practice's immediate needs and concerns. That's going to be, hey, my internet's slow. Our EMR is terrible. We have issues with passwords being reset or whatever. We also want to look at everything in your infrastructure. I want to see your router, your switches, your wireless access points, all that fun stuff. I'm gonna look at all your endpoints, and basically a mile high assessment of what you have going on inside your environment. The baseline HIPAA risk assessment, that's just going to be us, if you're here local in Florida, we'll gladly come to your site and meet with you. If you're remote, this can all be done virtually through a video call similar to what we're on today. We want to see everything physically, and then obviously from the backside with your IT assessment, it'll give me the information I need.
Also, how does it work working with you if someone's far away? Because I know that you can work with anyone in the country. How does it, like, let's say someone's up in some other state. So, because from what you told me before is that you would actually set that stuff up in your office if they need new equipment and everything, test it, and then you can ship it. You can walk them through exactly how to get everything set up.
We offer, I can work with anyone in the country. As far as equipment swaps, we can offer either you to do a self-install. So we'll give you instructions and we'll support you over the phone all along the way. Another common thing is we can send out a third-party vendor to come out and do the install for you. If it's a big enough install, I may fly people out there, send people to drive out there. Just depends on what's going on and what the realities of that look like. If you're in Alaska, unless you're a large facility, it's very unlikely that I'm going to be driving to you.
You could fly to Alaska and take a nice little trip out of it.
I mean, I agree with you, Andrew, but we're still, to consider cost. But let's say, we're in Florida, you're in Atlanta, would have no problem, sending people to Atlanta for a couple days to do an install, and an assessment. There's a lot of different ways we can handle that though. So it just depends on the client. Like I said, I'm very much into tailoring my packages around the client's needs. So whatever that looks like, a lot of times, and some of my big remote clients, we're just doing the back end. We're managing the back end. We're making sure updates are happening. They usually have either an on-premise hardware person, or I've got a full connection with a bunch of people when it regards to doing remote work. So we can send people out to run cable, do whatever needs done.
Okay.
And to finish out this sheet here, the hardware life cycle assessment, that's really simple. We take an inventory of the computers, we look at the serial numbers, and we verify the age, verify that they're still updatable. And then end of life software, if you're running an old version of QuickBooks or Quicken, we're going to pick up on that really quick during our assessment. And obviously that's a point of weakness in your infrastructure. So you'll be able to have all that in a nice, it's usually about 2 pages. I give you a PDF of all the items I find.
I know, well, that's great. I mean, because I'm sure it'll point out a lot of issues that a lot of offices have, and I think you mentioned to me before that you could go into pretty much any office and easily find some things that they're probably doing incorrectly.
I tell people all the time, and it's like fishing in a bucket. I feel it's unfair sometimes, because it's just little stuff, and it takes time, and that's why it's not a requirement to do everything at once, but the requirement is to start working towards being better.
So there's a hierarchy of, hey, we need to get this stuff done right away because this is going to get you hurt.
Regularly train your staff on HIPAA requirements and best practices. Maintain thorough documentation of all compliance related activities. Conduct regular risk assessments. And this is all stuff that can be done on a very small scale to start, and you can push it up as you go. And you'll find that even your business functionality will grow by not only becoming compliant, but streamlining your workflows and processes, condensing things down so you don't have 15 programs you're working on. You're working on maybe 2 or 3. Even the workflow in your office is something that can be changed. I moved one practice over to laptops from desktops. They were able to see an extra, I think, 8 patients a day across 2 nurses.
Why was that? Because so the nurse brings a laptop with them. I've seen it where they have it like on a little cart. They'll have a laptop. They'll just take some notes and then they'll move on to the next thing.
They've got slings. They just wear them on their side. So they roll up in the room. They sit down, open up the laptop. Okay. The one nurse is checking people in. The other nurse is behind her doing this. The other nurse comes back around, checks them out. Everything is done in the exam room. So they've got a receptionist up front. She literally just answers the phone and checks the door. That's all she does. The nurses do everything else. and the
Got it.
laptops improved. They didn't have to walk back to the computer and take what they wrote down and put it in the computer. They're putting it directly in the computer while they're doing the work.
Got it.
So,
Okay.
second here. I'm going to stop sharing for a second because it looks like I'm locked up.
Well,
I just wanted to share my contact information. Oh, let's do this. So my contact information will be up here on the screen. Just a moment. Can you see it, Andrew?
yeah, some of the bottom of the website.
Yeah, the bottom of the
Yeah.
website there. So my website's myfuture.com. And you guys are more than welcome to visit my website. And then we will put this out with my personal contact as well. But you got anything else for me, Andrew?
Good. No, that's it. I mean, just if you're a medical office, I mean, you got to get. I mean, the worst case, even if you feel like you already have a lot of this covered or pretty much everything covered, it's worth doing an assessment to see what's going on.
Yeah.
Because you might, because I'm sure that there are often things that are just not done exactly the way they need to be. So definitely do this. Reach out to Josh. I've worked with him personally. He's worked with a couple of clients of mine, and that's how we've been connected because I know that has integrity. I know that he does what he says he's going to do, but I've also seen him save people a lot of money because and you've shown me some of these quotes that the figures on some of these quotes that another IT company was going to charge him $50,000 for all this stuff, and you're like, well, we found out that they really didn't need all of this, that this is what they needed, and it was like a fraction of what this other company was charging.
I tell all of my clients, always make sure you're getting a second opinion.
Right.
Even with things I do, go price me out. That's fine. I always pride myself on giving people fair pricing up front. There's no beat around the bush. Oh, well, we can give you this discount. No, the price you get, the price you get. And I always work with my competition a lot of times. So I know where I stand. And I love small startup companies. I'm an entrepreneur. So these startup companies are kind of given the middle finger, for lack of a better description, when they go to one of these big MSPs and they're told, oh, hey, it's going to be $800 a month to manage my 2 computers. That's completely unreasonable. But a lot of these companies hold that standard because they don't want to deal with
they don't want the startups. They don't want the small offices. They don't want the single or 2 practitioner kind of offices.
Yeah. And I'm open to any of them because in my experience, I've got an insurance agency. I'm not going to specify their name, but he started off, he had 2 people. He's over 50 people right now. And just you become a large client of mine, and I've grown with him over the last 4 years. It's been phenomenal. So that was a small guy that someone else pushed out the door. I took him, and sure, it's a slow burn. You grow with them, but I enjoy that. I enjoy business. I enjoy seeing people grow from things I implement in their business. So it's a powerful win-win for both of us.
Well, great. Well, definitely. I appreciate you coming on and doing this meeting with me. And then, like I said, if you just reach out to Josh or I mean, look, if you got a local IT guy you love, fine, but unless even so, it's worth getting a second opinion to know that you're getting exactly what you need. Josh is flexible. He'll work with you. He'll make sure, even if you have an in-house IT person, you're working with someone, he'll make sure that everything is done the right way because you are trained in HIPAA compliance. You've seen so many of these different issues that people have had, that medical offices have had with their HIPAA compliance, and you know what to look out for.
Yep, absolutely. And Andrew, I greatly appreciate you giving me this platform, being able to talk, co-host this with you today. And anyone who needs marketing for their agency, for their business, definitely talk to Andrew. Andrew does a great job. I've got plenty of mutual clients with Andrew, and they're very satisfied with his services. So
yeah, thank you for that too. All right, guys. All right, take care.
Have a good day.
Yep, you too.